Good afternoon, everyone. Thank you for joining us today. Hey, Pete. So,
Thank you.
I'm just kind of waiting a few minutes for people to join in. So, I'll probably do a few announcements and some, I guess, housekeeping. So, I'm Carolyn Berry. I'm the executive director of Alzheimer's Arkansas, and I want to thank each of you for joining in to this month's Let's Talk. Uh, I know you could be doing a lot of other things like caregiving and taking care of people, but I hope this will provide you with some information and some resources that you need. Just a few things that's going on at Alzheimer's Arkansas. November is Caregiver Awareness Month, so we are celebrating the caregiver this month. Just want to thank each of you for what you do because I know sometimes you don't hear it enough, but we appreciate you for sacrificing and loving your loved ones. So, kudos to all the caregivers out there in November. Remember, you are important, not only to your loved one, but also to, just everybody in our communities as well, because we know our health structure is kind of already kind of fractured and it's overwhelmed. So thank you for being able and wanting to keep your loved ones at home. So on November the 4th, it's the first Thursday of November, we are having Night of Lights. It is a lantern uh, ceremony. We will light lanterns in honor of, in memory of those affected by Alzheimer's and other forms of dementia, or anyone that has passed away. If you would like to purchase a lantern, you can go to our website, alzark.org. It is at Bernice Gardens. If you need more information, please contact our office at 501 916 0712. Again, our website is going across the banner now. So, any information, events that you would like to know about, please give us a call and we can give you more information or go on our website. We will have a Essence of Hope. I know a lot of people have been asking, will we have a hope this year? And just based on COVID and all the uncertain parts of COVID, we will not have a in-person one, and we kind of came up with an essence of hope. We will provide education every Tuesday in November. We will put up videos of education and resources to help caregivers from the experts. So I know we have UAMS, AGEC, I believe, and Laura Spradley. They will be talking about fall risk. We have someone talking about maybe wondering. I will talk about some Alzheimer's awareness and some other things that could help caregivers in their journey. So please look for that information. We will post it every Tuesday. So, and of course, it'll be online and available after Tuesday, but that's when we will post every Tuesday. So, again, thank you to all the caregivers out there. Thank you for all our community partners and sponsors, people that have supported us throughout the years, and especially those who have supported us in the last 2 years, especially with COVID and the pandemic. Everything has changed, and we look forward to 2022 and all that it brings, and for us to continue to provide resources to caregivers. So, one of our education things is Let's Talk. It gives the ability for us to reach many more people. You don't have to leave home, or once it's posted, it's always there. So, look for those, and we are more than honored to be able to provide those. So, with that being said, today we have my friend Pete from Home Helpers. He is joining us today, and we're going to talk about funding options for in home care. So, this is merely a conversation, and it's easy. I know Pete, so he'll make it really easy on me. So, the first thing I'm going to do is allow Pete to introduce himself because Pete can do that way better than I can. Introduce yourself, Pete.
All right. Well, thank you, Carolyn, and hi, everybody. I'm excited to talk with you about funding options. My name is Peter McAdoo. I'm the president and owner of Home Helpers here in the Little Rock and Conway, Bryant area. And a little bit about me, huh, Carolyn? Well, let's see. I've been married 27 years to Debbie, and we have 8 children, 4 biological and then 4 adopted. The youngest is 19 and the oldest is 24. So we had those 8 packed all within 5 years. And I like to say that before we had all those kids, I had a full head of hair, and now I don't. So put those pieces together however you want to. About 6 years ago, Debbie and I decided to get into home care. And if Amanda could put up a photo, one of the reasons we got into it is because my grandfather, who I loved and adored, had a caregiver the last 3 years of his life. He was passionately independent, and he wanted to keep living at home as long as possible. He was one of these guys that's still mowing his lawn with a push mower when he's in his 80s. But his heart and his back and everything started kicking in. Amanda, if you could go to the next slide, or do I do that?
You can do that, Pete.
Okay, let's see if
we're going to let you
there
see.
He is. There he is.
Grandfather.
There he is. Yeah, he had more hair than I do at 85, but he was passionate about staying at home and living at home and dying at home. And the family had hired a caregiver named Charlotte who came in and enabled him to reach both those goals. She was actually with him the night he passed. So we thought that helped our family a ton. And this is something we want to get into and do. Debbie's a nurse, so she's the brains of the organization, the most important member because she understands a lot that I don't. And I'm the more the business marketing guy. And together, it's a great team, and we've been doing it for about 6 years.
Okay, so I always like to reiterate the different, like what in-home caregiving is and what it is not. So could you give us some insight on what in-home care is and what it is not?
Sure. Yeah, and I think the easiest way to differentiate them is with the words medical and non-medical. And they overlap really nicely, but they are different. Medical is not what we do. That's considered more home health in the industry. And that's things like in-home physical therapy, speech therapy, skilled nursing, that type of thing. And that's crucially important. The other part of the healthcare pie is then the non-medical. And so you got the medical, the non-medical. The non-medical is what we do. And that's more of the bathing assistance, fall prevention, ambulation assistance. A lot of falls happen when an elderly person is trying to get out of bed and move over to their walker, or a lot of falls happen in a bathing situation, trying to get in and out of the shower. So bathing assistance considered non-medical, helping someone get dressed, meal preparation, incontinence care with dignity, but helping people with that. Light housekeeping. We're not a housekeeping company, but we do housekeeping as part of our services. And then for our private pay clients, transportation assistance. We take a lot of elderly and disabled people back and forth to their doctor appointments. So home health, as Carolyn was saying, is more the medical. Home caregiving is what we do, and that's the non-medical with those examples. So I hope that helps.
Oh, it really does. Thank you. I always like to go back to that because, it can be quite confusing. So how is it paid for? So, because I know medical is usually paid for by insurance, right? Like you can get those through insurance. So how is in-home care non-medical paid for?
Great question. So let's talk about that. As Carolyn said, a common misconception, I was on the phone with a person this morning that thought that Medicare or TRICARE would pay for the non-medical side, and they just don't. I like to say if they'd pay us, we'd take it. But for our type of agency, the non-medical variety, Medicare, United Healthcare, Humana, Blue Cross Blue Shield, all of those medical insurances do not pay for the non-medical. They're great. They'll pay for the in-home health, the PTOT, skilled nursing, but they don't pay for the non-medical. And so people go, well, how am I going to pay for it? And so what I'd like to do is pull up a slide. I'll put a slide together here that will show you all the different options. And one of our passions is to help people find funding. One of the things that I hear a fair amount is, I know we need this, but how in the world are we going to pay for it? Okay. And so this slide right here gives 10 different funding sources. And of course, we'll start with number 10 because this is an Alzheimer's Arkansas broadcast.
Thank you.
Yeah, so we'll start there with number 10. But some of my very first clients back in 2015 started with an Alzheimer's Arkansas grant. And it provides a wonderful service to the family caregivers where you don't have to pay out of pocket. You don't have to apply for other funding mechanisms, and you can get a respite. And it's crucially important. I just faxed in another one this morning for another new client so that family caregiver can get a respite, some breaks, to go refresh themselves. So we'll start with number 10, the grants, and that they're very helpful. But let me go all the way back to the top to number 1. There are really 2 camps here. The first camp being personal funding. And private pay, a way to think about that is it just comes right out of your bank account, right out of your checkbook. It is the quickest way to start up because as long as there's money there, there's no delay in starting up care. About a third of our clients are private pay, okay? And it ranges everywhere from 12 hours a week all the way up to 24/7 care. So a lot of people ask, well, what hours of the day could it be? And it can be any hours of the day based on what the client's needs are. And so one way to pay for it is private pay. Another way to pay for it is if a family's done some financial planning and set up a spousal care trust, it can be paid directly out of the trust. I've not seen a ton of those, but it is a very, I will say, clever way that some lawyers, some elder care lawyers can help set up the funding in a way that a trust can pay for it, and then you can still apply for Medicaid. And so it's all legal, it's all above the board. Not my realm. I'm not a lawyer, but elder care attorneys are experts in that area. And if you like a reference to one near you, I've got several that I trust and use. The third area is long-term care insurance, or LTCI. We've got about 8 clients out of our 130 that have a long-term care insurance policy. And it's fabulous if you've got one. Some people say, I forgot I had that. And so they're very delighted to say, wow, I've got that. What a long-term care insurance policy looks like is you probably would have signed up for it at work or with a financial planner, paid monthly for years. We've started up with a new client that's paid for decades. And it is time to start pulling money out of that policy to pay for in-home caregiving. So if your parent or you or your spouse has one of those, it's time. It's time. And there are some real uniquenesses in each policy, and we'd be happy to guide you through key questions to ask that you want to find out before you start, engaging with the company. Things like elimination periods, daily maximums, those type of things, whether it's, as Carolyn was saying, home health or non-medical. Some policies pay just for the medical, but not the non-medical. So there's just some key things to look at in the policy if you've got one of those. Now, I said about a third are in that personal funding camp. For us, the other 2/3 are in the other buckets, call it item 4 through 10. And so, that's obviously the majority. And so I want to go through those because what we love to do, I was on the phone just this morning with a guy who's at UAMS and his wife, and they say, Pete, we can't afford it. We can't afford it. And so we went through, his income levels and all that, and zeroed in on he's a veteran. Okay. And number 5 is the thing that's going to help him. So we zeroed in on that. It's the Veterans Community Care Network, or VCCN. And it has no financial limits, no financial hurdles you got to get over. It was written into law with the Mission Act in 2018. It's not a ton of hours. Okay. Usually I've seen it between 8 and 12 hours a week. But it's 8 to 12 hours a week that someone else is paying for. Okay. And for me, both veterans programs is the government's way of saying thank you. Thank you for your service. So that's the number 5, the Community Care Network. Number 4 is also for veterans, and interestingly, for surviving spouses of veterans. And it's called the Aid and Attendance Benefit. Aid and Attendance, kind of a peculiar name, but basically it's eligible for veterans that were honorably discharged, that served at least a consecutive 90 days of service with at least 1 day during a wartime period. They don't have to be deployed. They could be at the Marine base in Camp Pendleton in San Diego during the Vietnam War, and they would qualify. Okay. There's other requirements there. The gentleman I was this morning with, he actually had a little bit too much income for that benefit because the VA has a max out of pocket. He's a fully disabled veteran. But we've got 1, 2, 3 on the Aid and Attendance benefit right now. And they're getting anywhere between 12 and 18 hours a week paid for. So veteran, let's talk. There's a couple options there. And, Deb and I have family members that are veterans. And so it's one of our delights to help veterans get some benefits to get the in-home care.
Okay, so I have a question about the Veterans Community Care Network.
Yeah.
Educate me, Pete. So on that one, you don't have this, the veteran does not have the same qualifiers as aid and attendance? Different qualifiers? Different
qualifiers, yeah. So with aid and attendance, you have to be under a certain amount of total assets. With the Community Care Network, you don't.
And you don't, what about the war period, serving the one, being in a war period, the 1 day, is that, no?
To my knowledge, it is not a requirement. I've never had to ask a veteran that question to get them involved. Basically, if your husband, your spouse, your loved one is a veteran, all they really need to get into the Community Care Network is to talk with their VA doctor. It has to be a referral by the VA doctor. And the VA will log into their portal and make a referral for the Community Care Network for that veteran. It then goes through social workers, and then they reach out to that person, do an assessment or a certain number of hours, and then that veteran's got the opportunity to select whichever provider they'd like to. So provider like Home Helpers, one of the many other agencies that are good in this area. And it's that simple, a VA doctor referral. It can't be a PCP that's not VA. It can't be a UAMS doctor. It has to be a VA doctor for the Community Care Network.
Thank you, Pete. I learned something today. I've heard of it, and I know it's kind of new, but thank you. I learned something today. Cool. Put something in my toolbox. I appreciate that. Okay, so you can go ahead with the next ones.
Now, the next 4 all have the same first word, Medicaid. Medicaid. We're a licensed provider in the state with the Department of Human Services and with the Department of Health to provide Medicaid services. And there's several different programs. Okay. The one that is probably the one that you'll see the most hours per week or per month is the AR Choices waiver, Medicaid AR Choices waiver. They now have an online portal. You have to have a login and an ID and a provider ID and all that. So we actually help probably between 5 to 7 people per week apply for the AR Choices waiver. There are financial requirements on that one. It's Medicaid. You've got to meet their hurdles or be under their hurdles, if you will. And so there's financial criteria and functional criteria. The cool thing for this audience that's listening in, that has a loved one with Alzheimer's or dementia, Alzheimer's dementia diagnosis from a doctor means you're going to get into the AR Choices waiver program. That meets the functional requirements. Okay. On the financial, you'd still have to meet the financial requirements. And I'm going to throw you two numbers out. And if you want to jot them down, you'll at least know what the criteria is for the AR Choices. The individual's income has to be less than $2,382 a month. Less than $2,382 a month. That's the income. That's not the savings. It's what's being deposited into the account each month. So whether it's SSI, it's Social Security, it's retirement benefits, whatever it is, put all that total together. And as long as that total is less than $2,382 coming into the checkbook each month, they meet that first financial criteria. Second number to jot down is savings. It's how much they actually have saved up. It can be, CDs, 401ks, cash underneath the mattress. It can be a savings account at their bank. But you total all that up, and for an individual, it's got to be less than $2,000. Okay, less than $2,000. For a couple, it's got to be less than $4,000. Less than $4,000. And so I mentioned number 2 up there, the Spousal Care Trust, where an elder attorney can advise and help. This would be one of those situations where that could be very helpful, because the Spousal Care Trust will be put to the side and not be part of that criteria. It's pretty cool. Okay. So that's AR Choices. Typical.
So I have a second question.
Sure.
So when you gave us the income for AR Choices waiver, you gave us the individual. Do they look at both, or is it just the individual's income that they look at?
It's just the individual.
Okay.
On the income piece. That's right.
All right.
Good question. All right. The next one is Medicaid personal care. This maxes out at 14 hours per week, 14 per week, paid for by the state. AR Choices is typically in the 20 hours to 40 hours realm per week. Okay, so you can see it's a little bit better in terms of hours, a little tougher to get. There's a lead time on it. The personal care can begin a lot quicker, but the income requirement is less than $870 a month. Okay, and less than $870 a month. So that's income again. That's what's coming in from Social Security, DB, whatever. Very good program. That one, if you meet all their criteria, can typically be started up in 2 to 3 weeks. Okay, it's a much more streamlined process. Whereas the AR Choices waiver currently is taking between 4 and 5 months to get through the government pipeline. Okay, it's a long wait. And we can get someone enrolled and applied for within a matter of really 30 minutes on the phone, and then we need a couple documents. But literally, we can get that done very quickly. And then the rest of the 4 to 5 months is waiting on the government pipeline. Yeah. There's such a need, such a backlog. They're all working hard. I'm not sure they have enough staff, but they're trying to get through that as quickly as possible.
Okay.
Accelerate a little bit. The Medicaid PACE program is really cool. It's a holistic program that has both doctors, in-home caregiving, physical therapy, and a facility to go to during the day for socialization. Very nice program. PACE. If you Google Complete Health by PACE, you can find it, or you can contact me at Home Helpers, and I can give you a little bit more overview on it and connect you in with some of the people there that do the intake, the enrollment. And then the Medicaid PASS programs, PASSE. That PASS program has been around for just a couple of years. There's 3 or 4 different providers in Central Arkansas that are actually across the whole state. And it's for the people with a disability or with a mental disability. Okay. So it's more focused into those areas. But again, it's a very good program, and it's targeted for that. You get assigned a case manager that keeps track of your account and checks in with you. So Medicaid PASS program. And then we finish up with where we started, those great Alzheimer's Arkansas grants. Huh, Carolyn?
Absolutely. Thank you.
So to sum up then, if you've got the personal funding, quickest way to start up, great clients, great way to help get you some breaks. And then the other people's money category, whether it's veterans, Medicaid, Alzheimer's Arkansas, will help you find funding that's available if you qualify.
Thank you, Pete. That's a lot of information, but some great information. So there, you may have a choice if you can't pay for it yourself, but if you can, that's the fastest way.
That's right.
And I guess you say you help people. You say one of our passions is to help people find funding. So even if they have to start off private pay, you may be able to help them and find one of those other funding sources until, they can get those until it comes through or whatever. So
that's exactly right.
Okay. Anything else? So one of the questions is private pay, is this expensive? Is in-home care considered expensive? It's one of those things that it's expensive to pay for.
It is. I guess it depends. Your view of it being expensive or not is based on where you're coming from, but it's typically between $23 and $25 an hour.
Okay.
And what that covers is, of course, the caregiver, the background checks, the drug tests. They're all bonded and insured. If you go through an agency, they're covered with workers' comp, and then they are assigned a care manager. For all private pays, get a care manager that supervises and checks in every week with the family just to make sure everything's going all right. And if we need to make any adjustments, if there's been a change in mom or dad's health, to change the care plan. And so it covers all of that. Basically you hire the agency and the agency does the screening and training of the employees. You don't have to worry about W-2s at the end of the year or pulling out taxes or all that type of thing. It's all done by the agency.
Do you have a startup fee? Like sometimes there's a deposit or a lump sum for startup fee. Do you have a fee for that as well?
I've heard of some agencies doing that. We don't have a fee to start up. We just want to help people get into care. We do have for our private pays, we do have a 1 week security deposit. Okay. And basically it's kind of like an apartment. We hold it till the end. It just gives us the confidence that, okay, we've got signed paperwork, we've got security deposit, we can go ahead and assign staff. Okay,
sounds good. Let me see if there's any other questions that.
Could I tell you one?
Do you have a minimum? So do you have a minimum amount of hours that you must?
Yes, for private pay, it's 12 hours per week, a minimum.
Okay.
For the VA, I mentioned that some of those come in at 8 or 10 hours. If it's a veteran, we'll do that.
Okay. Makes sense. So you're going to tell me something else before.
I was going to tell you a quick story of a recent client that came in. He was, I won't say any names, obviously, but a professor, a doctor, and he came down with Alzheimer's some number of years ago, about 8 years ago. His wife has never had a caregiver into the home. She told me that about 5 years ago, it was the last time she could have a two-way conversation. He's a very happy guy. He's got a very nice disposition, but his disease is at the state where he can't really communicate besides one or two words, that type of thing. And so she's just at the point where she said, oh my gosh, I love him. We've been together forever, but I do need to get out and do something for myself. I need to go to a doctor's appointment for myself, and he can't be left alone. And so right now we've started out where we're just coming in 12 hours a week, 3 mornings, 8:30 to 12:30. She goes, gets her hair done. She goes to her doctor appointments. She can go to the grocery store. She does some things. I said, go have lunch with a friend. How long has it been since you've done that? And she said, oh my gosh, could I really? I said, absolutely. That's what we're here for. We want you to take some breaks. And from the day that I met her, I would say it was about 5-6 weeks ago to now that she's had the care, she's laughing again on the phone with me. She's kind of recouped some of that joy. And not, I don't want to sound negative at all, but when you're 24/7 as a family caregiver, that's one of the reasons that Alzheimer's Arkansas is there, because you do need support. You do need some breaks. And I just want to encourage you to consider that. Some people feel guilty about it, like, no, I'm supposed to do it. I think from my story, what you'd hear is that person, that wife, is able to actually do it better than she was before because she's refreshed. And
Absolutely. Absolutely. Thank you for sharing this story, and thank you for educating us today on funding options for in-home care. We really appreciate you, Pete, all you do for Alzheimer's Arkansas, supporting us. So thank you again, and
thank you.
I look forward to seeing you soon out there in the world. I'll talk to you soon.
All right, Carolyn.
All right, so we do have Let's Talk every third Thursday, same time, 2:00. I don't know who we have next month. I'm so sorry. Like, I don't have it on the top of my head, but the next Tuesday we will have Coffee with Carolyn and Gigi at 10 a.m. So it is it's a support group, but it's kind of a little bit more relaxed, and grab your coffee and come and just share with us and talk about the things you want to talk about. It's for caregivers. You do have to register for it, so you can go to our Facebook page, or you can go to our website and register for it. It is via Zoom. So it is for Zoom. So join us next Tuesday with Coffee with Carolyn and Gigi. Of course, November is Family Caregiver Month, and we will be doing different activities and events to celebrate the caregiver, as well as Night of Lights on the first Thursday of November, the 4th, from 5 to 7 at Bernie's Gardens. So please, if you need any help in your caregiving journey, or you need someone that need resources, please reach out to Alzheimer's Arkansas at alzark.org. If you want information about what we talked about today with Pete, you can call Pete, or you can call the office. So thank you all for joining us, and thank you, Pete, for talking to me. So until next time, let's talk.
All right.